Welcome, welcome, and good evening, folks. We are bringing people in from the waiting room into the virtual space here all together. We're excited to have everyone here tonight for the Governor and Lieutenant Governor's Badger Bounceback Live Session. We ask that as folks are entering into this space, that you just have your devices muted and you have your cameras turned off. That is just a request for now. There will be an opportunity later on in the session for you to unmute yourselves so that you can speak and be heard. And if you feel comfortable, for you to turn on your cameras. It just makes it easier for our technical team as we're inviting hundreds of folks into the space. It makes it easier if everyone starts off with their devices muted and their videos turned off. Thank you all very much for accommodating us, for being here this evening. We are excited to hear your voices and your stories and the excitement about the Governor and Lieutenant Governor's Badger Bounceback Live Session on affordable and accessible healthcare. right. Well, looking at the time that we have now and looking at the waiting room, I will do a final welcome, and good evening. Once again, my name is T.R. Williams, and I serve as the Deputy Director of External Affairs in the Office of Governor Evers. And you all are here tonight for the Governor and Lieutenant Governor's Badger Bounceback Live Session on affordable and accessible healthcare. And with that, I will turn it over to our Lieutenant Governor, Mandela Barnes.
I am here, and thank you so much, TR, for getting everybody excited for a budget listening session. These sort of things, it can be a little bit difficult to get the energy going, but you do an incredible job at getting people excited about our plan for bouncing back. And so I want to thank everybody for being here today. Again, I'm Mandela Barnes, Lieutenant Governor. Really excited about this particular portion of our Badger Bounceback listening sessions. And so again, that's why I'm excited that you all are taking time out of your evening. We're excited and happy to hear from people tonight about this topic because it's one that is critically important. It's been important to me since before even deciding to run for Lieutenant Governor. I know that it is an issue that impacts so many people across the state. And we know that we can do so much more when it comes to the delivery of health services here in Wisconsin. For far too long, people in this state, our children, our families, and people just in general haven't had the access that they deserve to quality, affordable healthcare. And this past year has highlighted just how critical that healthcare is for all of us. A public health emergency where people still had trouble, whether it was with their own health insurance, losing a job, whatever the case may have been. We saw millions of people in jeopardy, not knowing what to do, not knowing where to turn. And that's where we have a responsibility to step in and act. We need help to make that happen. We saw nurses, our doctors, and public health professionals make incredible sacrifices to keep us all safe. And we were all forced to recognize how an untreated medical condition could easily become a life or death situation for someone. Now, in our last budget, we fought to expand access to thousands of Wisconsinites and also invest in improving our healthcare system for everyone. And now with the Badger Bounceback agenda, we are building on that work so that we can recover from the devastation of the pandemic and make our communities even healthier than we were going into the pandemic. So not only are we working to expand BadgerCare like in the last budget, we're also laying the groundwork to create a public option in our state to give people more options for affordable healthcare. And we're investing in mental health services and telehealth, and also supporting our healthcare infrastructure so that we can be more resilient in the event of another crisis. And we're also investing in health equity and targeting our horrific racial disparities so that we can finally make Wisconsin a place that is full of opportunity, regardless of your background, regardless of your zip code. I couldn't be more proud of this budget, couldn't be more proud specifically about this part of the budget. Now, our administration is excited, and we're excited about these proposed investments, and we recognize that this is a bold plan that will help ensure that our state comes back better than ever before. And so, again, I'm eager to hear from everybody tonight. I want to thank you all for being here. And now it is my turn to introduce my friend and our Governor, Tony Evers.
Thanks so much, Mandela, and thanks for that kind introduction. And also, TR, great work, getting people fired up. Wonderful. Thank you, TR. And thanks all of you, I think I saw a number of 232 people plus for joining us tonight. Last month, I announced my 21-23 biannual budget proposal, and I set forth a great plan for accessible and affordable health care. Now, I'm here again tonight to listen because I've said before, this budget is not my budget. It's your budget, the people's budget. These Badger Bounceback sessions are an opportunity for me and Lieutenant Governor to hear directly from Wisconsinites about how this budget will impact you, your families, and communities across the state. Last week, we held our first Badger Bounceback Live Session on economic recovery and opportunity. During that session, I was able to hear from Wisconsinites all over the state of Wisconsin. Tonight, I'm excited to be back for our second session to talk about how we can increase access to affordable health care in Wisconsin. And if there's anything that the COVID-19 pandemic has underscored, it's that the health and wellness of our state and our economy depends on the health and wellness of our people. Whether it's affordability or accessibility due to lack of broadband for telehealth services or transportation to get into town, too many Wisconsinites continue to face barriers to accessing the health care that they need. That's why my biennial budget proposal invests in expanding access to affordable healthcare in 4 critical ways. First of all, we're proposing expanding BadgerCare to provide coverage to 90,000 Wisconsinites and save our state $1.6 billion, ensuring telehealth services are covered, the same as in-person services, investing in mental and behavioral health resources for the folks that need it, and addressing health disparities by investing in health equity initiatives and curbing social determinants of health. We're also going to tackle the rising costs of prescription drug prices with over 20 policy solutions to help lower costs and increase transparency, because picking up your medications should not break the bank. And folks, all across our state, we're experiencing a caregiver crisis. So we're investing $600 million in our long-term care, direct care workforce, and family caregivers. And finally, we're going to continue to protect and ensure the coverage of over 2.6 million Wisconsinites with pre-existing conditions. I'm not going to make these important decisions about you without you. That's why it's critical that we have these sessions and that you all join us in this discussion. We need to work together to build the sort of future that we want for our state. So don't let your advocacy end here tonight. The budget's now headed to the Joint Finance Committee and the Wisconsin State Legislature for their consideration. We need you to contact your local state representatives and let them know why you support this budget and what you want to see in that. So let's work together to get this budget over the finish line. Let's get it done. Now, in closing here tonight, I just want to share one more 30-second healthcare story. The Lieutenant Governor and I were able to visit the Ho-Chunk Community Center in Black River Falls today. That tribal nation of the Ho-Chunk has done an outstanding job in vaccinating their own tribal members today, and they've made great progress. So today they opened up their facility at the community center in Black River Falls to serve non-members of the Ho-Chunk Nation that lived in that area. They expected to serve over 1,000 people today. Think about that, 1,000 people being vaccinated in one day in a small town, neighbors helping neighbors. I'll tell you, that is what Wisconsin is all about. And that's why we want to make sure that we do the right thing for all of Wisconsinites. So thanks for taking the time out of your night to be here, and I look forward to hearing from all of you. TR, it's back to you, ma'am.
Thank you, Governor Evers, and thank you for sharing that story. So welcome again, folks. For those who are joining in the waiting room, this is the Governor and Lieutenant Governor's Badger Bounceback Live Session on affordable and accessible healthcare. I just want to go over a few housekeeping things to set all of you all up for success for this event tonight and the conversations that'll be happening tonight. So as you remember, if folks, for this main part, if you can have your devices muted and your videos turned off, that helps us accommodate all of the hundreds of folks that are in this space. I would also say for those who were not able to be in this space this evening, that this is going to be recorded and streamed on the Governor Tony Evers YouTube channel. So for folks who couldn't be here tonight, but are joining us through the YouTube channel, welcome and hello. I also want to let you all know that the topic tonight on affordable and accessible healthcare included a very beautiful one-pager or two-pager when you signed up and registered for this event. We wanted to give that to set you up for success so that you can know what's included in the governor's budget. But we also want to do a few other things tonight. In order for the conversations to be most meaningful, for your voices to be heard, for you to share your stories about your excitement for the budget and how the budget impacts you, and for you to educate yourselves on what's in the budget, we want to have smaller conversations. So we will have breakout rooms this evening. In those breakout rooms, you will have different leaders from state agencies, including the governor and the lieutenant governor's office. Included in those breakout rooms, you'll have a person who's identified as the facilitator. That person's job is to make sure the conversation continues to move forward, that makes sure that folks who may be having a lot to say are sharing the airspace with those who may need a little bit more encouragement or a little bit more silence before they feel comfortable speaking up. You'll also have someone in that breakout room who's designated as the note taker. And that note taker wants to make sure that we are sharing your stories, the questions that you have, the feedback that you have, that we're sharing those accurately. So it's possible that the note taker or facilitator may ask you to repeat yourself or repeat your name or your organization. It's not to be rude at all, but it's to make sure that we have accuracy in reflecting your voice. You'll also have a policy expert in each of your breakout rooms. That person is designated to answer any questions that they can to the best of their ability that you may have. And once again, if it's not a question we can answer in the moment, that's why we have that note taker there who can copy that down and reflect your question. You will also know, for those who have previously registered for this event and noted that they needed any sort of accommodation, that we have our ASL interpreters, Carly and Nicole, here tonight. Thank you, Carly and Nicole. We also have our Spanish interpreters, Glenn and Michael. Thank you, Glenn and Michael. For those who are using the ASL interpreters, you are able to hover over that square and pin them to your screen so that you're always able to constantly see them. Amelia from the governor's office would have emailed those instructions to you ahead of time as well. When the breakout rooms happen, there will be nothing that you have to do. You won't have to touch anything. It'll happen almost by magic, but it's our awesome tech team who's making it work. For some of you all, you won't move. You'll actually stay in this main breakout space here. That's intentional. Don't worry, nothing wrong is happening, but we'll be using this main space as one of our breakout rooms as well. I will note for folks that if you leave the breakout rooms, you will not be able to re-enter into this large session here, and you won't be able to hear the final remarks that we'll have from the governor. So if you need to take a break, mute yourself, turn off your camera, but don't leave the breakout room because that won't allow you to jump back in. But if you happen to get disconnected in any way, again, Governor Tony Evers' YouTube channel will be streaming this conversation live, and we'll also be recording. I think those are all of my housekeeping items as I'm double checking my list here. As a last ditch effort to set you all up for success in these conversations, we do have the governor's senior policy advisor, Noah Roberts, here to share more information on the governor's budget.
Thank you very much, TR, and good evening, everyone. My name is Noah Roberts, and I serve as a senior policy advisor to Governor Evers, and I'm pleased to build off of the remarks of the governor and lieutenant governor and provide an overview of some of the initiatives that are being proposed to make healthcare more affordable and accessible for Wisconsinites. As was mentioned, right now, too many Wisconsinites face barriers to accessing healthcare, and for a variety of reasons, from rising costs to healthcare workforce shortages. Governor Evers' healthcare budget proposes bold and common sense solutions to address these issues. Governor Evers' Badger Bounceback agenda includes expanding BadgerCare, which will provide coverage to tens of thousands of uninsured Wisconsinites and save hundreds of millions in state tax dollars. The governor also calls for Wisconsin to transition from a federal to state-based insurance marketplace to increase flexibility and improve enrollment efforts, as well as creating a premium assistance program to help make healthcare more affordable, while also authorizing the Department of Health Services and Office of Commissioner of Insurance to design and develop a public health plan or public option health plan. We also know that telehealth services have become critical during the pandemic and are a valuable tool in expanding access to healthcare services. Governor Evers' budget includes a telehealth parity provision that would work to reduce barriers and make telehealth easier to access. This is in conjunction with a $200 million investment in broadband expansion and internet accessibility. The Badger Bounceback agenda also tackles skyrocketing prescription drug prices by controlling costs, increasing transparency and oversight, strengthening consumer protections, and bolstering programs designed to support Wisconsin's most vulnerable. Governor Evers is calling for the creation of the Office of Prescription Drug Affordability to provide oversight over the pharmaceutical supply chain, establishing a $50 copay cap on insulin, and the establishment of a prescription drug affordability review board to analyze and set price limits. The governor's budget also improves access to healthcare by providing more than $40 million to bolster targeted mental health services, investing more than $50 million in school and community-based mental health programming for school-aged children, and $25 million in targeted investments to support folks with substance use disorders. Governor Evers also proposes reforming emergency detention and crisis intervention in Wisconsin by allocating $25 million to boost front-end preventative services, support regional crisis centers, and bolster alternatives to emergency detention like rapid response mental health teams. Furthermore, the governor recognizes that the long-term care community and caregivers are facing immense challenges. That's why Governor Evers' Badger Bounceback plan delivers on several policy recommendations proposed by the governor's task force on caregiving and invests more than $600 million in Wisconsin's long-term care infrastructure, the direct care workforce, and family caregivers. The Badger Bounceback agenda also continues to prioritize bolstering Wisconsin's healthcare infrastructure and strengthening the state's response to the pandemic, investing more than $400 million in hospitals, local health departments, and other public health initiatives. The governor's budget makes the largest public health investment in at least the last 20 years. And finally, the disparities in access to healthcare and in health outcomes, particularly for communities of color that face systemic racism, are simply unacceptable. Taking bold action to address disparities is an essential component of the governor's healthcare budget. The governor calls for a $25 million investment in efforts to address the determinants of health, like housing, nutrition, and transportation. And Governor Evers also proposes allocating more than $30 million to promote community-based health equity initiatives, investing almost $30 million in Healthy Women, Healthy Babies initiative aimed at improving women's health and birth outcomes, and investing more than $12 million to comprehensively address childhood lead poisoning. Governor Evers has proposed dozens of initiatives to improve healthcare in Wisconsin, from mental health and caregiving to health equity and prescription drugs. These initiatives represent bold and historic investments, but are also common sense proposals that both help make Wisconsin healthier and save billions of dollars over the next few years. We look forward to hearing your thoughts, feedback, and stories about how the governor's initiatives to make healthcare more accessible and affordable will impact you and your community. Thank you, and back to you, TR.
Thank you, Noah. All right, you all, we are ready to have you all move. You don't have to do anything, but you will be moved into the breakout sessions for the next 15 minutes of conversation. Looking forward to it. Hello, everyone. Awesome. That looks like that's working well. I see folks moving in. Good evening to those familiar faces that I see already. Excited to have you all here with us. Awesome. So I'll get started because our 50 minutes have started and you all have heard my voice a lot and I want to hear your voices. Real quick, I'll just remember as housekeeping, remind you that we have several folks who are designated in this room this evening. I'll start with myself. I'm TR Williams. I'm serving as the facilitator just to make sure we can get conversations moving and folks able to say the things that they have to say. I also am happy to have Andrew Hoyer Booth here with us as well, who will be our policy expert from the Department of Health Services. And also, I consider them the champ of the group, the one we couldn't move forward without. We also have Jarrell Ballard here, who will be our note taker this evening. Thank you, Jarrell. Thank you, Andrew Hoyer Booth. Awesome, you all. I do recognize that we have Secretary Underson from Department of Children and Families here. Good evening. Thank you very much. And so I will mute myself in a second here. I do have some facilitators facilitator questions, but I have a feeling with looking at the eagerness of this group and the people who I know that are in this group that we may not need the facilitated questions. So I will open it up for some initial conversation. Folks can feel free to raise their hand through the Zoom app. I'll be looking at that. If that's too much, no worries. You can physically give me a sign that you would like to speak as well, and I will make sure that I'm monitoring that. And as soon as I said it, I see Ed Cohen with his hand raised. I will keep an ongoing list here, and I will mute myself and welcome the floor to Ed.
Thank you very much, and good to see you again, TR. First off, I'm a strong supporter of the governor, and I applaud the governor and lieutenant governor and all the rest of the team for the budget. The particular area of interest of mine that I'll speak to is mental health, and the funding that Noah spoke to and that is in the governor's budget should go a long way towards providing help for children and their families. I'll tell you a little background, and then I'll tell you a story related to how I came to what I'm going to tell you today. And I'm a licensed clinical social worker who's retired from active practice after about 40 years of working with children and families. One day, a number of years ago, I was in my office working with a private mental health clinic that you had to have insurance pretty much to get into. Otherwise, well, I happen to be a Medicaid provider as well to provide equal access to people. But most of my clients at that point, a number of years ago, were private pay people with insurance. So I received a call from parents who said that they had just walked into their kitchen and their son, who was a high school student, was sitting in a chair in the kitchen with a gun. Here's what happened. First, I'll tell you that it had a happy ending, and that his dog saved his life. Here's how that happened. His first girlfriend, love of his life, broke up with him, and he had decided that he was going to take his own life, to die by suicide. His parents were out running errands, doing whatever they were doing. They didn't realize the seriousness of what was going on. They didn't realize that he was hurting so badly. And he was planning on shooting himself at that moment. And his dog happened to walk into his room, or maybe a guardian angel in the form of the dog, who knows. But anyway, dog walked into the room. The young man stopped to pet his dog. Parents walked into the room, saw their son with this weapon, and called me. I saw him later that afternoon. Over the course of some months, he turned his life around, learned some things about that relationship and how the devastation that he felt at that time was not forever. He had, in fact, for his girlfriend, given up his sports, many friendships. He had shrunk his life to a very small amount so that he felt there was really nothing left and nothing left to live for. Many young people aren't so fortunate. Many young people in those situations die. They die from suicide, the result of a mental illness. It's very possible that at that time, with more mental health professionals in the schools, that what he was struggling with would have been noticed, or the story about the girlfriend could have gone around the school, been overheard by counselors, psychologists, social workers in the school, and it would have never gotten to that point. With added funding, it's very possible that there are more eyes and ears in the school to feel that pulse, and hear the dialogue around and prevent situations like that from occurring. And obviously, the situations where they don't go so well and they result in death or struggle for high school or elementary school years, or even longer. The other thing related to that is that I was a member of the Waukesha County Juvenile Officers Association, which is an association of social workers and police. There were some very good officers in there, some of whom were school resource officers. But the reality is they're not trained mental health professionals. So no matter how good they were, they couldn't take the place of a crisis intervention team of mental health professionals in the schools. Police need to do their jobs to keep people safe. Mental health people, substance abuse professionals need to do their jobs to help young people who are struggling with mental health and substance abuse needs. The added benefit of shifting money from those police departments to put people in the schools to mental health people is that that school to prison pipeline that's primarily working in underserved communities with many people of color, that pipeline will be broken because people will get services early on. They won't be criminalized when there's a mental health crisis going on or a substance use crisis going on, and kids' lives will be saved and many others will flourish when they wouldn't have otherwise. So I applaud once again the governor's efforts. The money going to mental health and substance abuse services in the school will help tremendously. The need is all the greater due to the pandemic. And I hope that the budget is able to be passed by the primarily Republican legislature for the sake of those kids and their families. Thank you much for the time, TR.
Thank you so much, Ed. It is good to see you again, and I appreciate you kicking us off with those remarks. I see Erica Andre's hand, and then Aaron Miller, I see yours next. So I'll go to Erica and then Aaron.
Hi, thanks so much. My name is Erica, as you said, and I am a adult living with a physical disability. I live on my own in my own apartment with my boyfriend, and I'm able to do that because I have 24-hour care in my apartment. I have muscular dystrophy, so I'm not actually able to do anything for myself. I rely on caregivers to do everything. For the last year, due to the pandemic, we've kind of shut it down, and it's just been me and my boyfriend, and he's been doing all of my care 24/7, 365, well, probably more like 380 days now, because this pandemic will not stop. But now we are both vaccinated and going to be getting back out into the world, so yay. But that also means that I'm going to be bringing caregivers back in, and I can tell you that this caregiver crisis is no joke. There are just not people out there that want to do this work for the pay that they're going to be getting. And I do consider that I go through IRIS. I use the IRIS program. So I am able to set my own wages for some of it, and I'm able to pay a higher rate because I do require some pretty complex medical needs. But it's still just not enough. But also the lack of healthcare for the people that I hire is a huge deterrent, because I am in a self-directed program. I am my own company. So that means I don't have health insurance. I can't have health insurance under the company of Erica Andres. So anyone who works for me has to either have a second job or, get it out of the marketplace or things like that. When you're only making $13, $14, $15 an hour, to pay $350, $400 a month for marketplace insurance is just not an option. And so a lot of people just can't be caregivers for me because they can't afford to lose their insurance if they start working and come off of healthcare or off the, BadgerCare. So I really am excited that some healthcare reform is going to be happening and things like that. But I just really want to speak to that because I'm also, not only do I use the IRIS program, but I am also an IRIS consultant. So I also work with people with physical disabilities, developmental disabilities, mental illness, and frail elder. And just everyone I know that has to hire caregivers is just really struggling and having a hard time finding qualified applicants that can do the work, but also can afford to not have all the benefits that they get from not working. I mean, it's honestly sad that they get more not working than they do working. And there are some really amazing people out there that I would love to hire, but just can't afford to lose what they have right now. So.
Thank you, Erica, especially for, sharing a personal story. You certainly didn't have to, but we appreciate that. And can you remind me again, if you said it or if you feel comfortable just sharing, what part of the state are you in? What region of the state?
Milwaukee. Sorry.
Milwaukee.
Milwaukee.
Great. Thank you. Thank you. So I have Aaron next, but I do want to call out that Janet Zander, I saw your hand. Rachel, I saw your hand. And Eva, I saw your hand as well. So I'll go to Aaron first.
Okay, briefly want to thank Erica Andres. It should be noted that IRIS also serves a lot of rural folks. So when the Republican legislator eventually takes a lot of stuff out of the budget, they might want to know that IRIS serves a lot of rural people, their constituents. The next thing I wanted to mention is that I love somebody with a mental illness. That, surprise, we're not scary looking. We lead normal lives like anybody else, and they manage their condition very, very well. Both their parents are nurses. And honestly, she's lucky. We're both lucky that we're well supported and have people around us. But that could all go straight down the toilet if something happens and have to schlep us like 2, 4, 5 hours up to Winnebago. It would make much more sense to invest in regional crisis centers and just be around our family and friends. It's where you know folks. It's so.
Thank you, Aaron. It's always good to see you and to hear your voice. I appreciate you and I hear you. All right, I want to call that I have Janet next, but I do want to recognize that I saw Gabby and Helen Marks Dick's hands as well. So Janet, the floor is yours.
Thank you, and I really appreciate this opportunity. And I want to piggyback on some things that Erica said, because I really think that her pointing out the struggles that she's had trying to hire workers and the information she shared about the workforce crisis just points out how critical our family caregivers are. In her case, she mentioned how critical it was that her boyfriend stepped in, and we have families and friends and neighbors all across this state stepping in to provide care that needs to be made available. And I really appreciate the fact that this governor's budget supports family caregivers by making sure in particular that those individuals who are caring for somebody with Alzheimer's or dementia gets the support they need, whether that's expanding dementia care services statewide. We know that these folks are really, really challenged sometimes to get the support they need in their communities and from the systems in their communities. And those folks really help make that possible. Or by expanding the Alzheimer's Family Caregiver Support Program dollars, getting respite services and supplies and support services into their homes is so critical that it'll enable them to continue to provide the care that they provide as a complement to that paid workforce, which as we all know is challenged so much. And last but certainly not least, acknowledging that caregivers are spending a tremendous amount of their own money out of their pockets to provide care for a loved one. And so that caregiver tax credit that he included in the budget to me really speaks to sort of a nod to say, we hear you, we understand that this is really impacting you as well, and we want to do something about that. So I appreciate the opportunity.
Thank you so much, Janet. Rachel, I have you next.
Yeah, so I definitely appreciate Governor Evers addressing healthcare as an issue since it's a problem for so many. I'm actually the leader of a group that's working toward Medicare for All. I'm the regional organizer with a group called Democratic Socialists of America, and I'm based in Milwaukee. And I think the main issue is that money is like a barrier both to treatment for people affording their coverage, as well as getting people to work as a caregiver. A lot of caregivers don't make a living wage. They themselves have to pay for health care. I definitely know as a person that struggles with their own health care and health issues, as I have like 2 or 3 ongoing issues, that it's hard enough to afford a premium, much less ongoing treatments. I myself have a bunch of debt because of this. And the more we can do to make it affordable, like a $50 cap on prescriptions is good, but that's still a lot. $50 a month for something would be a lot for me to afford. Thankfully, I'm not currently on any prescriptions. So definitely I'm happy to see it addressed. Mental health care is a huge issue. Even before the pandemic, there's a lot of stressors in life. Having a lot of stress is why a lot of people have chemical dependency issues. So definitely the more steps we can take to getting people covered would be great. And I just want to say that Medicare for all would beat a Medicaid expansion, but a Medicaid expansion is kind of a half step between where we are and where we could be. So I'm happy to see things addressed at all. And that's kind of my main ideas. So that's what I got.
I appreciate you, Rachel, and appreciate that feedback as well. Thank you. I have Eva next, and then Gabby, and then Helen Marks Dix. I haven't seen any other hands, but if I miss someone after Eva speaks, just feel free to unmute yourself and let me know. Eva, the floor is yours.
I think you're on. I think you're on mute, Eva.
Yes, I am. Okay. Thank you, TR. It's good to see you again. First of all, I want to thank the governor for this budget. I think it addresses a lot of needs. I'm here specifically because I'm interested in his initiative to fund a behavioral health treatment program for folks who are deaf, hard of hearing, and deaf blind. I head up a committee, I facilitate a committee in which all three of those groups are represented. And we know that these groups have been underrepresented, they've been underserved for a long, long time. Even back in 1979, I think Jim Weiner developed a report that said that we need to pay attention to the mental health needs, and not much has changed since then. There are many kinds of people with hearing loss, and they need different kinds of access in order to get the appropriate treatment. So one of the problems is that we don't have providers in this state that really understand the linguistic and the cultural implications of hearing loss. I think within the whole state, we have one direct service provider who she herself is deaf, but and who is in private practice, and that's not very much for the whole state. So we're looking really for this initiative to help to bring in more and to train more people so that they can be more linguistically and culturally sensitive to the needs of all of those groups. If you're talking about hard of hearing people, they will access services probably with their primary language, which is English. There's a huge group out there, but within that group, there are late deafened people who become have hearing losses as a result of aging. So they have a whole bunch of other needs. Then we've got the deaf population, which really their first language is American Sign Language. And so English is a second language for them. So if they don't have people who understand that, often we have people who are misdiagnosed because of the lack of understanding of service providers. And then also deaf and hard of hearing people have the same kind of issues that the hearing population has. I am a retired teacher of the deaf as well as a marriage and family therapist. I've worked in this field for over 45 years. I come from a family of deaf parents, so I've seen the whole gamut and I know that it's really important for deaf and hard of hearing people to be able to access services when they're depressed and when they're feeling anxious and when they have all the same kinds of issues, but it's very difficult to get access to adequate mental health services. So I'm very hopeful and thankful that the governor recognizes that we do need some specialized services for this population so that the ground is more, so that it's a more level and equitable playing field for people who have hearing loss to be able to access services so that they don't get worse. Sometimes you can just, you can educate people or so you can begin to treat them when they're not so bad. But once it gets out of hand, then you've got all kinds of things to deal with. And we don't have the services to adequately serve this population. So we were very hopeful that this item that the governor has suggested will stay in the budget. It's very, very meaningful to us. We have people all over the state who are watching this. The committee that I'm facilitating has only one representative from the northern part of the state, and we certainly would like to see more services, although the population is not there as much as it is in the southern part of the state. So I'm just hoping that there will be also, because we have so many different kinds of people with hearing loss, they need different kinds of accessibility. They need interpreting if they're deaf. They need captioning if they happen to be hard of hearing. They need tactile interpreting if they happen to be deaf-blind. So there are lots of different needs that have to be met, and there isn't adequate funding for that. In addition, we find it hard to bring in people who are themselves deaf or hard of hearing to give direct service, because they need supervision in order to earn clinical licenses. If you provide a person like that with supervision, there's no funding to pay for the supervision, to pay for the interpreting, so that the supervision can occur. So that the problem is multifold. So I am very grateful that the governor has put this initiative in, and I'm hoping that it'll stay in the budget.
Thank you so much, Eva. It's also good to see you again. And I'm definitely grateful for your service and your work. Appreciate your words tonight.
Thank you.
I have Gabby and then Helen Mark Sticks, and Heidi, I did also see your hand raised as well. I want to pause just in case there are folks who are not on video or who may be joining us by phone, if there was anybody else who wanted to get in the queue to speak this evening. Okay, we have about 25 minutes left, so if you change your mind, that's fair game. You can do so. All right, Gabby.
Hi, my name is Gabby Henshu. I am a Master's of Public Health and Master's of Physician Assistant Studies student at UW-Madison. First of all, I just want to say thank you so much for holding these listening sessions. It's so great to be able to voice kind of our opinions on the budget and give input. As a lifelong Madisonian, that means a lot to me. So I just want to reiterate support for all of the mental health funding that is in the governor's budget, especially that which is for the schools. I work as a CNA at St. Mary's Hospital in Madison, and I work on a neurology floor as well as a trauma floor. And so many of the patients that we see are either intoxicated on substances or withdrawing from substances, and so many of them have issues in their past that they were unable to seek treatment for, kind of known as adverse childhood experiences, which have so many negative consequences. And, you know, up to 60% right now of Wisconsin adults report having experienced these and report negative consequences in their lives from these. So addressing these earlier in schools, I think will be able to make a huge difference for people. And it's been proven that, you know, addressing these things as early as possible is, one, more cost effective, and two, makes a huge difference in the physical, mental, and behavioral health outcomes for people. And, you know, it's just really hard when you're working and you see these people that have brain bleeds from using substances for so long, and they were first given substances by their parents at the age of 12. I mean, that's not something that is ever okay. And it just we need to do some stuff about that. So I really appreciate the mental health funding for especially programs in schools. I think that will make a big difference in the long run. So thank you.
Thank you, Gabby, and go Badgers. Helen Mark Sticks, and I do want to say that Janice and Ida, I have you in the queue. I do see your hands as well.
I'm Helen Mark Sticks. I'm with AARP Wisconsin. And of course, I echo many of the things that Janet Zander said, particularly about family caregivers and the support for the recommendations of the caregiver task force. I'd also like to say a few words about reducing the prescription drug costs, which is a big care and concern for older people. But I also want to say something about the complexity and the scope of this budget. I think what's pretty amazing is we can all tell individual stories about how we're affected personally by these things. But when you look at the broadness of this and the basic affordability and accessibility for so many people on so many issues to make so many individual lives better, it's pretty amazing. And unfortunately, the budget often talks about money without thinking of the literally millions of people that get impacted, particularly on healthcare, prescription drugs, and all kinds of specialized programs. This is the first time in the years I've done the budget work that I've seen so much emphasis put on mental health, something that we have been under concerned about or have not reflected in our budget priorities over time. I think the caregiving crisis that this pandemic brought up, both of the paid and unpaid workers, has been phenomenal. And I think I want to say a word about the process, because not only did we touch thousands and millions of people with the way the budget is set up in healthcare, but the process of how we got here using the task forces and using citizen input over a period of time and listening to all those stories is pretty powerful, because it translates it from the monetary concerns to the human concerns. And what I worry about is that we're all singing to the choir tonight. We need to talk both the money and the individual stories to the people who are going to be voting on all these things. I mean, I feel for each and every one of these stories. I support all these programs, but probably everybody in this room does too. So I think we have to remember how many lives this impacts, how many individualized in a sense, whether it's deafness or mental illness or cultural challenges or geographic challenges or access issues. It's pretty phenomenal. And we can't let the debate turn into welfare and the other person. This is us. This is stuff that we got to do. And there's, as I say, our big three here are going to be the recommendations of the Caregiver Task Force, the recommendations of the Task Force to lower prescription drugs, and of course, the Badger expansion that I've been fighting for years. And if I could only say 3 words, I'd just keep saying accessibility, affordability, and reliability. And boy, it touches us all.
Thank you, Helen. It's always good to see you and the red frames. I appreciate your words and your advocacy and your consistency. Heidi, I have you next. The floor is yours.
Thank you. I was going to comment too on Helen's frames. She has me beat. I just have a question, and that is, does this budget include, and if not, is there a plan to include the 10% increase in the federal match to Medicaid that is for home and community-based services issued under the recently released rescue plan? So it's like millions of dollars for Wisconsin.
Yeah, Heidi, I appreciate the question. That is something that is, like you said, was passed in the American Rescue Plan Act, providing that 10% increase for home and community-based services. And I think the good news there is I don't believe that's something the state has to apply for necessarily. That is just something that is it's not tied to Medicaid expansion. And so that is something that the state will be eligible for, regardless of what happens with any particular provision in the governor's budget.
Right. And sorry, I just turned on my camera. Yeah, I mean, the issue is it just has to be, it starts April 1st, access to that monies, and then we only have it for a year. So wondering just if there is any plan to get input on ideas for how those monies, which are very important monies, potentially could be utilized in the next year of service under Medicaid in home and community-based services. which I think matters to some of what I've listened to in the speakers. Thanks for sharing all those great stories and experiences. But would we take that up with budget committees, or what do you think for an approach there?
Yeah, I guess I would say in terms of sort of the approach and strategy from the department's perspective, I mean, we're still, I think, like everybody, digesting some of the language from that very large bill to to figure out the exact impacts, methodologies of how it's going to come into the department, and where we can use those funds as well, just to make sure that there aren't any certain restrictions. So I think we'd be happy to communicate that more broadly once I think the agencies and others know that information as well. But like you said, the good news is it was passed and it is included, and something that there's no further action from the state level to actually receive the benefit from.
Okay, thank you for that. I appreciate it.
Thank you, Heidi, and thank you, Andrew, for jumping in there as well. For those who are not on camera, who may be joining us over the phone, I just want to recognize that Governor Evers is in the space here with us. He's hopping around so that he can hear directly from you all as well. And so just wanted to call that out. I have Janice next on my list, and then Ida. But again, I want to pause just in case there's anyone who couldn't maneuver the raised hand button, or that's on the phone that wants to be recognized, and I can put you in the queue. Okay, we have about 16 minutes left, so you are free to change your mind if something comes up. And with that, Janice, I will give you the floor. And I think you're still muted.
Okay, unmuted now? Okay.
Yep.
Okay, all right. Well, I just wanted to follow up on the introductory remarks that talked about expanding BadgerCare to 90,000 people, 1.6 billion. Is that what Governor Walker turned down 10 years ago? And is that like people who are low income working could get into BadgerCare, but they haven't been able to for the 10 years? And if that's the case, is there some place where that 1.6 billion explanation is, where I could start writing letters to legislators and to talk to people who don't have health insurance yet because they can't afford it and don't know, could probably be part of BadgerCare? So that's my question. Is that what Walker denied and what we haven't had for 10 years? And do we know there are states that took that Medicare expansion where Wisconsin didn't? Have those states had to chip in their own money? Because wasn't that the reason that Walker turned it down, that said, well, the feds might back out and then we'd have to pay for it? So is that the expansion? Have we been, is it like we threw away 10, 12 years worth of money that could have helped these people? And is there an explanation somewhere on a website or a policy paper that I could look at? Thanks very much.
Yeah, those are all great questions, Janice. I appreciate that. And I do think both potentially the budget in brief that's on the Department of Administration's website, and also the DHS budget proposal, which is a document within that executive budget, would provide some additional background there. But certainly the Medicaid expansion that's proposed in the 21-23 biennial budget, as you mentioned, would cover an additional 90,000 Wisconsinites. And so that certainly would provide additional coverage and access to a pretty large number of Wisconsin residents. And in addition to that, would provide the state with about $634 million of GPR savings. And that's just from that 2-year period for this biennial budget. The additional billion that you referenced as well to get to the 1.6 number, that $1 billion was a byproduct of the American Rescue Plan Act that was passed at the federal level recently. And so if Wisconsin were to expand Medicaid, we would be eligible for an even greater proportion of federal dollars because of that legislation, and that would be in place for 8 quarters or two years essentially. So that would be a limited time benefit and increase, but certainly an enormous benefit that could be reinvested into healthcare or other areas of state government to continue investing in needed services.
And do we know if the states that took that expansion, has it cost them money? I mean, that was why we said why Walker said we couldn't have it, because it might cost us money. Is there a way to find out, or do we know what happened with those other states?
Yeah, I mean, certainly the percentage that the federal government would cover for Medicaid expansion, I believe when the Affordable Care Act was first passed, was I think 95% coverage for that expansion population, and then decreasing by I think 5% in subsequent years. And so the concern originally when the law passed was, well, it starts off at this rate and then it goes down a little bit, and then who knows if there's going to be continual coverage even beyond that. And so then the states will be on the hook for everyone else who's now gained coverage under the Affordable Care Act. What we can say is that has not happened, right? The federal government has continued to maintain that support and that level of support. And so, certainly for the state of Wisconsin and others who haven't expanded, not only those individuals who have not been covered in healthcare have lost out, but the state has also lost out on, hundreds of $millions and probably billions of dollars at this point in time as well.
We can hear you. Great questions, Janice. Thank you for your voice. And I do have Ida next. Is there anyone else? I just want to double check as I'm looking through. Anyone else who I may have missed? Feel free to unmute yourself and just say, TR, put me in the queue, or give me a physical signal if you have your videos turned on, and I'll do a scan here. Okay, I think we're good with 11 minutes left. Ida, the floor is yours. Welcome.
Thank you. Thanks for having me tonight. So I'm Ida Winters. I am a parent of a child with autism and a parent of 2 other children with special health care needs. I work with Mental Health America. I'm the coalition for Milwaukee's Children's Mental Health co-chair for the Community Health Worker Strategy and parent leaders with lived experience. I am also the group facilitator for Autism Society of Southeastern Wisconsin Morning Coffee Group. And I also am a family navigator at the Next Step Clinic. So today, what I would like to do is share something personal. I'm a family navigator, which is covered up under the community health worker title or umbrella. And I just want to tell you, I provide services to families, helping them have early identification, diagnosis, and treatment for their children. And we do autism screenings, evaluations, because here in the city of Milwaukee, our waiting list for evaluations for autism and outskirts where they can go to, but a lot of them can't get access to care there, or they're not feeling that they're getting the treatment that they deserve. So when families call me, so there's 2 family navigators, we're both part-time and we're grant funded. So we can only work part-time and we're grant funded. So at the current moment, my caseload is 80 families. In families, there may be 1, 2, or 3 people being evaluated in the family. So when they call in to me, they're calling in telling me my child needs to be evaluated. The teacher says this, they can't sit down, they can't stop rocking, they can't stop whatever. My heart goes out to them because my son was just finally diagnosed at the age of 13, a month before he turned 14, that he had autism. And there was no early intervention or anything. Like now, he can't even get ABA therapy because he's too old. And we have the issue where nobody wants to do evaluation over a child that's over the age of 8. So a lot of kids are being missed. The early intervention is being missed. Instead, they're being suspended from school. And when they're suspended from school, they're not learning. And then next thing you know, it's the pipeline from school to prison. And I'm just asking that. So I just did advocacy day. That's why I'm saying calling, sorry. But I'm just asking that, more funding is put in more places like Next Step Clinic, where we're doing this. All of our services are totally free. We're doing behavior therapy as well, or parent-child interaction therapy, and the Early Start Denver model therapy. So we can do it because ABA is a little stressed too. So there's a long waiting list on there. So we try and do supplemental services. Most of our services and evaluations are provided by students who are under supervision, but like I believe it was Helen said, there's no money to fund them to supervise either. So we need more money put into issues and things like, if we don't invest in our children, we don't invest in our future, because the children are the future. Thank you.
Thank you, Ida, for your words and also for your service on behalf of Wisconsinites living in Milwaukee and everything that you're doing. And it's okay if you said call and be advocacy. We don't mind advocates in this space at all. So we appreciate you, Ida. I'm scanning through. I don't see any other hands raised through the Zoom app, but I'm scanning through my screen here to see if there are others who might be giving me a physical motion that they want to speak, or if not, if there are others who want to just unmute themselves to speak. I will pause and mute myself for a second, because sometimes I know it just takes a little while to get your thoughts together. So we'll just have a moment of silence if it makes it easier for folks to jump in. And I will note that we have 6 minutes left in our conversation and our time this evening.
TR, I'll speak briefly. My name is Emily Amundsen, and I'm really pleased and privileged to serve as a member of this administration at the Department of Children and Families. And I just want to say that this has been a real bucket filler for me to listen to all of you tonight. I tend to look at the budget through the lens of children and families. And so I really see all of the aspects of the programming that knit and weave the supportive fabric that we need out in communities to support kids, families, and communities. And I'm just so pleased to hear stories tonight that indicate that you are also doing that. You are also seeing the pieces of this budget and the ways they fit together to make each proposal stronger in communities, to benefit families, and then of course to benefit kids. The comments tonight on mental health were so important to hear. The investment in mental health programming in schools, and then I'll just highlight in the DCF pieces of the budget, the investment that we're making in supportive services for families to hopefully prevent entry into the Child Protective Service system. So much of the mental health pieces that we've heard tonight are part of that puzzle too, right? And just creating the kind of environment that where we can be assured that kids and their families and communities have what they need to be successful. So just want to say thank you. It has been a real pleasure to hear from all of you tonight. And in particular, Helen, I just want to say it felt very good to hear that you saw the process as a strong process, and that the task forces and the ways that this administration works with community, not just in advance of the budget or not just tonight, but all the way along to create the kinds of proposals that are meaningful to Wisconsinites. That again, it made me smile, and it made me feel like, yes, we're doing something here. So really appreciate everybody's comments. And again, thanks for letting me be a fly on the wall tonight as well. TR, you just make my day. So thank you as well.
Thank you, Secretary Umdenson, and ditto to those comments about the stories tonight. While folks are deciding if they want to pop in, I will just mention again, Andrew Hoyer Booth did a great job when Janice asked a few questions of just letting you know that in addition to that summary that you would have been able to download and look at in preparation for tonight's conversations, you can go on to the Wisconsin Department of Administration website where it'll have the governor's budget in brief. So it breaks down that large document into plain language, much shorter document for you to look through the details of the governor's complete budget, including the parts on healthcare. In addition, on that Department of Administration website, you can also go agency by agency. So you can choose Department of Health Services, or you can choose Department of Children and Families, and specifically see their budget, which is included in the budget in brief. But sometimes if you don't want that full document, but you just want to hone in on a particular agency, those things are available for you all. We have 2 minutes left in our conversation tonight. I want to make sure that if there are any other voices that haven't been heard, that you have the opportunity now. Heidi, I do see your hand again. I'll pause just for a second to see if there's anyone who hasn't had the chance to speak that would like to unmute themselves or raise their hand with the 2 minutes that we have left this evening. All right then, Heidi, the floor is yours.
Just quickly, are the budget committee members listed there too, or how do we find them?
That's an awesome question. Just to make sure we're on the same page, you're referring to the members of the Joint Finance Committee?
Correct.
Yes. So that the members of that committee you can find through the Wisconsin legislative site, which I should be able to have on me. I always forget that is WIS. Is it legislative.wis? Let me not say it wrong. Let me have it up right now so I can say it right. Oh, I see Andrew's unmuted himself. You have my back, Andrew?
I think, oh yeah, it should be legis.wisconsin.gov.
Yes, LEGIS, legis.wisconsin.gov.
Okay, thank you so
Andrew
much.
Hoyer Booth has never let me down. Great question, Heidi. Yes.
Yeah.
So yes,
and I do
go on
appreciate
there.
you guys. I appreciate your energy so much. Thank you for making this fun.
I'm glad to hear that feedback. I'm glad that it was fun. But that's a perfect segue, Heidi, that yes, the Joint Finance Committee is the committee of 16. They include members of the Assembly and members of the Senate, Republicans and Democrats. They make up the body who has the first sort of whack at the governor's budget now that he has announced it and shared it with them. They will be the ones who do the first taking in or adding of things that are in that budget. The Joint Finance Committee does have an email inbox where they are receiving comments. So to the point that Helen made earlier about folks also advocating and sharing the comments you've shared tonight with that legislative body, because they do have that power, folks can feel free to email them. That's another one that I may need your alley-oop on, Andrew, if you have that email address, because I can't remember it offhand.
Sorry, I need to find the unmute button here. Yeah, yep. the email inbox is budget.comments@legis.wisconsin.gov.
Will you quickly repeat that? You have 84 seconds.
Certainly, I can make that work. Budget.comments@legis, legis.wisconsin.gov.
Thank you so much.
You are welcome.
Awesome. I think that's the perfect place to end our conversation tonight so that no one's words gets cut off as we're getting the signal that we have 58 seconds and counting before the breakout room ends. I'll remind folks to stay here since there'll be some last final wrap up comments from the governor. So just stay here. You'll be automatically put back into the main session, and then we will be able to wrap up tonight. I appreciate you all's words, your service, and being here. Welcome back, everyone. Hoping that you all were able to have some meaningful conversations, connect some dots. We thank you all once again for being with us this evening to share your stories and your comments. I believe as folks are entering back in the room, we do have the governor here as well. Just double checking my screen here. If the governor is back into the room, then I will turn over the space to you, Governor.
Thanks, TR, and thanks. I had a chance to visit several of the groups, and I know Lieutenant Governor Barnes did too, and it was just really outstanding work. And you know, I felt the energy in the room. There are times when people were, you know, talking about the politics of, you know, Medicaid expansion and how obtuse and unhelpful that the people that are blocking Medicaid expansion are, and you know, we do need to fire up around that issue. There's absolutely no way that we should be once again being one of the last states in the country to accept help where we could be providing a lot more services. And then I went to other groups, and they're talking about really important things around mental health and how we're going to be how we can even expand upon what we have in our budget in the future. But at the end of the day, it was just a great conversation around how important health is to our state's economy, to our state's status as a great place to live, how it impacts our economy. And it's one of those dot connectors that plays out every day in our state, and how important it is to have access to the best possible health care possible. And I just really, really thank everybody for being here today, sharing your ideas, sharing your suggestions, and being activists around this issue, because I can think of no other important topic other than, you know, education and making sure that we have good broadband and others. But health is something we have to be active about. We have to be activists about good health care. That's important to everybody. So I'm hopeful that you will continue to be activists. And activist is a good term. A lot of times people talk about activists in a negative way. Activism is important, and we are at an inflection point in the state of Wisconsin. And I encourage you to be activists around not only my budget, but healthcare in general. We have to hear from the people of Wisconsin. The legislators have to hear from us. And please don't be shy. We need your help, and we need your help now. So whatever you can do to be that activist for yourself, for your community, for your next door neighbor, please be active. So that's my message. That's what I heard, and every stop I made going forward or going through this evening. And I just thank you for all your good work. And let's get some huge wins out of this budget. Don't let any legislator tell you that we can't afford this. We can't afford not to do it. So thanks so much, everybody. Thanks, TR, for doing a great job, and thanks to all the facilitators and note takers, and that really made this a special night. But especially thank the people that took an hour and a half out of their night and talked about how important healthcare is to the people of Wisconsin. So thanks, everybody.
Good night.